George Mason University, the largest and most innovative public university in Virginia, just earned a little bit more to brag about as the first ever College of Public Health to have an accredited Immersive Technologies lab. As a public health professional and recent MPH grad, I was curious to learn more about the Interprofessional Lab for Immersive Technologies, so I swung by Peterson Hall at George Mason's Fairfax Campus to meet up with Bethany Sislowski, Chief Innovation Officer at the College of Public Health, to get a first-hand tour of the lab and see what all the excitement's about.
Every simulation starts with a pre-brief to prepare them for, let's say, the disease process or the effects of opioid abuse on a family. In addition, we'll give you a technology overview. You're going to wear a headset, you're going to use controllers, and kind of prepares you for the scenario. So we start with the pre-brief. They go into the scenario or the virtual reality simulation. We're really able to do anything that we need our learners to learn. We can actually reconstruct and provide that opportunity for them.
Once I put the headset on, it's easy to see what she means. I find myself in a clinical setting evaluating a pediatric patient, administering medication, and reassuring the patient's mom. Then I also try out a social work scenario where I'm able to dive into casework to hone my client interaction skills. All right, do you guys want to tell me what's going on?
She isn't doing well in school, even though she usually loves school.
I quickly realize I have a lot to learn, so I take a step back and watch Maeve, a Master of Social Work student, go through the paces and build the soft skills and critical thinking that are so important for students to learn.
It's nice to meet you. And what was your name again? Jerome. Wonderful. Nice to meet you. Would you like to...
How many times have you done this same scenario?
I've done this scenario twice now.
And what would you say was the most surprising part of the experience?
How realistic it was, the things that the clients say, and the situation they're experiencing, the setting is all really realistic and something that a social worker could expect to see in the field.
Initially, I was skeptical about virtual reality. That was before I tried it.
Dr. Melissa Perry is the Dean of George Mason's College of Public Health. Dean Perry has an ambitious vision for the Lab for Immersive Technologies and is the lab's biggest advocate.
And then I tried it, and then I realized, actually every student that comes through this college should have exposure and should have an opportunity to experience this.
It was really great to be able to experience a different population and a different setting than I've ever seen in the real world. It was a good way to practice and to experience new things.
So I came to learn that the debrief is just as important as the VR itself. So what did you find helpful about the debrief?
I was actually surprised how helpful the debrief process was. I wasn't expecting it to be so helpful.
We end with a debrief, and we start with your reaction, and a lot of that is because we believe you need to get out your emotion before you can cognate or start to really think about the case. Then we go into an analysis phase, which is really like where we deconstruct the event and then reconstruct it with new knowledge and best practices and learning moments. And then it ends with a summary or takeaway, which is my favorite part, and that's really, what did you learn today that you're going to take into clinical practice or into your setting?
After meeting the team of certified healthcare simulation faculty, speaking with students, and learning more about Dean Perry's vision, it's clear to see why the Lab for Immersive Technologies is the first of its kind to be fully accredited by the Society for Simulation in Healthcare.
What's been so exciting at George Mason is recognizing how innovative we truly are. It's very much in our DNA. And I've discovered that this university is nimble. It wants to take risks. It wants to do things differently. I feel as though our virtual reality laboratory and our immersive technologies opportunities are responding exactly to what Mason has to offer the tens of thousands of students that come here.
To learn more, visit publichealth.gmu.edu.